Thank you all for being here this evening. We have a fair bit of ground to cover tonight, so I hope you've all had dinner and have had a coffee. So this is where we're going to head. I want to talk to you a little bit about euthanasia laws around the world and the legality of euthanasia and assisted suicide around the world, how they've been extended since those laws were enacted in the countries where they've been in place for some time, the effects of euthanasia laws on society, particularly on vulnerable groups, where we're at in Australia. I also want to talk a little bit about how we might have these types of conversations with family and friends, and how you might get involved in the fight that we're expecting in New South Wales in the coming months over euthanasia. So a fair bit of ground, but I'll try and make it quite brief because I'm looking forward to Q&A. It's been really great over the last couple of weeks to hear so many questions from you guys, and that's where I think the majority of our time should be spent this evening. So some of you might not know this, but Australia was the first country in the world to legalise euthanasia. Back in 1995, the Northern Territory passed a law to allow people to access lethal drugs to die. The law came into effect in 1996, July, and was in place for about 9 months before the federal government overturned it. And I don't want to get into aspects of constitutional law and the reasons why the federal parliament was able to overturn it. But in Australia, the federal government can override laws made in the Northern Territory and in the ACT. And it did so in the case of euthanasia. Outside of this small exception, euthanasia, like abortion, is a matter that's governed by the states. So you would know that euthanasia and assisted suicide laws are already operating in Australia, in Victoria. They've been passed in Western Australia and in Tasmania, but these are yet to come into effect. A bill to make euthanasia and assisted suicide legal in South Australia passed its upper house last week, and it's expected to be presented to the lower house in the coming weeks. On Tuesday, the Queensland Law Reform Commission provided a report and a draft bill to Parliament, and that's now sitting with the Queensland Attorney General, with the expectation that sometime this month that bill will be introduced into Parliament for debate and for a vote. Queensland only has one House of Parliament, and so the vote will probably occur quite quickly. By mid-year, euthanasia and assisted suicide could be legal in every Australian state except New South Wales. Some might suggest that this is just Australia keeping up with the rest of the world, but it's not. Only about a dozen countries out of 190-something countries in the world have legalised some form of euthanasia or assisted suicide. For most of the world, it's still illegal and actually pretty abhorrent. So the first thing you should know is that euthanasia does not receive broad acceptance anywhere. It's still something that the overwhelming majority of the world rejects. It's also rejected by the medical profession. The Australian Medical Association has affirmed its position against euthanasia and assisted suicide, saying that doctors should not be involved in interventions that have as their primary intention the ending of a person's life. The World Medical Association is even stronger than that. It calls euthanasia and assisted suicide unethical and say that it must not only be rejected, but condemned by the medical profession. In fact, they're so against it that the World Medical Association directly petitioned the Victorian Legislative Council during the debate and asked them to reject the laws. Across the world, 107 of the 109 national medical associations that make up the World Medical Association reject euthanasia and assisted suicide, including in countries where the practice is legal. It's also not supported by palliative care specialists, some of whom you heard from last week. And the Australian and New Zealand Society for Palliative Medicine also reject euthanasia and assisted suicide, saying it's not part of palliative care and they don't support its legalisation. When the Victorian laws were being debated, more than 100 Australian palliative care professionals signed an open letter asking parliaments to reject the legislation and petitioning instead for adequate resources to help them care for people at the end of life. In the same letter, they said that euthanasia advocates often undermine their good work just to push their deathly cause. Imagine that. Imagine euthanasia advocates being so incensed on getting their way that they will undermine the good work of people like Dr. Sharbel Bajani, Dr. Lin Lim, people who you heard from last week. And then we have an open letter from health professionals across Australia who have signed up with their name and details made public, insisting that they are against euthanasia. Father Ronnie wanted me to show you the list. Ooh. So I'll try and hit play on this. This is a list on the website of the Australian doctors who have signed up against euthanasia. And the list is growing every day. Why are medical professionals so against it? There are many reasons. Yeah, it's still going. But some of them include that it would fundamentally change and weaken the doctor-patient relationship, and it would detract from the protection of the vulnerable who can come to feel like they've become a burden on others. Interestingly, there are even doctors who think that they shouldn't be involved in this at all. They say it's actually vets who are better equipped and actually more experienced at giving these types of drugs to their patients, and so euthanasia should be done by vets and not by doctors at all. In places where euthanasia has been legalised, you'll hear of doctors speak of the psychological toll it eventually takes on them, as well as the pressure that they receive from the families of the patients to pressure the patient into euthanasia. I'll give you just one illustration. In Canada, before euthanasia was made legal, about 77% of doctors said that they supported euthanasia. In the 5 years since it's become legal, those numbers have turned, with now 3/4 of Canadian doctors signifying that they have a conscientious objection to euthanasia. Euthanasia is very different in practice to how it is in theory, and the doctors have found that out. That's how euthanasia affects the medical profession. But how about the rest of society? You'll often hear those who argue in favour of euthanasia, many of them well-meaning, that it's a personal choice. If you don't want euthanasia, then you don't have to have it, they'll say. But don't you dare take away my choice at the end of life. Now, there are a few problems with the personal autonomy argument, but probably the main one is that while death is personal, it's never private. And a decision to allow state-sanctioned suicide affects more than just the individual involved. I've just told you about the impact on doctors. Obviously, there's the impact on the patient's family and friends, but it also has flow-on effects for other members of the community in terms of the quality of care and the choices available to them. The exercise of one patient's personal autonomy can affect the choices available to others. At this point, I want to introduce you to a couple of friends of mine. The first is a woman named Barbara Wagner. Barbara was a 64-year-old great-grandmother living in Oregon, a US state that legalised assisted suicide in 1997. She'd suffered from lung cancer, but was in remission. And then the cancer returned. She was insured under the Oregon Health Plan, a government healthcare plan that provides insurance to those citizens who are living on or below the poverty line. Here's a bit of Barbara's story.
Her doctor offered hope in this bottle, the new chemotherapy drug Tarceva.
Like my doctor said, maybe this can put the lid on it and stop it.
That hope shattered with this letter from the Oregon Health Plan telling her we were unable to approve the cancer treatment. It will pay for comfort care, including physician aid in dying, better known as assisted suicide.
I told him, I said, who do you guys think you are? To say that you'll pay for my dying, but you won't pay to help me possibly live longer.
We took our concerns to Dr. Sam Saha, chairman of the commission that sets policy for the Oregon Health Plan.
She says, to say to someone, we'll pay for you to die, but not pay for you to live, it's cruel.
I don't think anyone's saying that. That's, I think, maybe an unfortunate interpretation of the letter.
Assisted suicide critic Dr. William Toffler calls the message disturbing.
People deserve relief of their suffering.
not giving them an overdose.
And he says the state has a financial incentive to offer death instead of life. Chemotherapy drugs like Tarceva cost $4,000 a month. Drugs for assisted suicide cost less than $100.
Is it cheaper to pay for somebody to die than to help them live?
That is not a question that we think about. We don't think about investing our healthcare dollars in that way.
Yet when thinking about patients like Barbara Wagner, Dr. Saha admits they must consider the state's limited dollars.
If we invest thousands and thousands of dollars in one person's days to weeks, yet we are taking away those dollars from someone. So you look at,
if we invest thousands and thousands of dollars into somebody's days to weeks, then we're taking those dollars away from somebody else. But we don't think about the money when we're making health insurance decisions, right? That was in 2008, and Barbara died not long after. The next person I want to introduce you to is a woman named Stephanie Packer from California. In 2012, Stephanie was diagnosed with scleroderma, a nasty condition that causes scar tissue to build up on your lungs and made it hard for her to breathe. The doctors told her that she had 3 years to live. This naturally turned Stephanie's world upside down. She was 29, a mum of 4 kids, aged between 3 and 9 years old. Her doctors were wonderful, good and caring, and provide her with the treatments for her condition, including the chemotherapy that would help her live longer. In 2015, 3 years after she was diagnosed, the doctors recommended to Stephanie that she change her chemotherapy drug to one that would be less toxic for her system. Her insurance company verbally approved the change, but then California passed their assisted suicide law. A week later, she got a letter from the insurance company saying that not only would she not be covered for her chemotherapy, she also wouldn't be covered for her pain medication or for her oxygen. But lawmakers in California had wanted to make sure that the media situation that surrounded Barbara Wagner didn't happen again. So the Californian euthanasia law, assisted suicide law, actually has a provision in it that says that insurance companies are not allowed to offer a patient assisted suicide in the same letter where they deny them coverage. If you're going to offer them assisted suicide, you've got to deny them coverage first and then send a separate letter. So Stephanie rang the insurance company to see what happened. She said, you approved my drugs, you just said you were getting the paperwork ready, and what happened here? And then the woman on the other end of the line was a little bit flustered, and then she said, can I ask you about the assisted suicide drugs? Can you tell me, are they covered? And she said, yes, and you'll only have to pay $1.20 as your payment gap to get them. Here's what Stephanie had to say about the choice that assisted suicide in California has offered her and her family.
As you allowing those patients to make that choice affects me negatively, and it affects my fight and my ability to stay here longer with my children. I want to carry on. I want to do everything I can to have one more second with my kids. And as soon as this law was passed, and you see it everywhere, when these laws are passed, patients fighting for a longer life end up getting denied treatment because this will always be the cheapest option.
Where's Stephanie's choice? People will say to Stephanie, if you don't want assisted suicide, you shouldn't have to have it. Where's her choice? Her family's choice. The stories of Barbara and Stephanie are not isolated. Last year, 15 of those who chose to die in Oregon in the United States cited the financial implications of their healthcare treatment as their reason for their request to die. As horrible as it is to say, financial considerations do come into it. Canadian researchers have found that the cost on average of caring somebody in the last year of their life is $50,000. It takes up 10% of Canada's healthcare budget to care for people in their last year of life, even though it only makes up less than 1% of the population. A different group of researchers in Canada found that euthanasia could reduce annual healthcare spending across Canada by between $34.7 million and $138.8 million. We'll get back to Canada in a little bit, but there are financial savings for governments in pushing euthanasia. Absolutely there are. What about palliative care? Most of you were here last week when we had those wonderful palliative care doctors and nurses talk about the importance of their work. And I don't know about you, but I was absolutely captivated by them. How could anyone listen to them and not think that that's the type of care that they wanted for their loved ones and for themselves? How many of you want Dr. Bajani or somebody like him pulling up a chair beside your mum or yourself or your husband or your wife and giving them the type of dedicated care that he was talking about last week? The work of palliative care is so good and so needed. You might remember that Adrian Simmons, one of our rockstar seminarians, asked about the availability of palliative care in places where euthanasia has been legalised. And I want to talk about that for a moment because we held off that question from last week and said we'd answer it this week. Before it legalised euthanasia, the Victorian Parliament conducted a massive inquiry into end-of-life choices. Of the 49 recommendations made in that end-of-life inquiry, 30 of them related to the improvement of palliative care funding and access, and only one related to the introduction of assisted suicide. Palliative Care Victoria looked at the recommendations and said, look, for $65 million a year, we'll be able to implement all of these 30 recommendations. The government gave them a donut, nothing. And instead, their first order of business was to introduce euthanasia and assisted suicide. It was only after those laws came through that the Victorian government allocated $62 million, not in 1 year, but over 5 years. So less than 20% of what Palliative Care Victoria said was needed to implement the recommendations made by the Victorian Parliament's own inquiry. So euthanasia advocates will look at that and they'll say, well, palliative care funding increased after euthanasia. You know, it doesn't affect palliative care funding negatively because the government added more money to palliative care funding after euthanasia was legalised. And technically that's true, but they were starting from such a low base that it's insignificant. Because it's also true that Victoria had and still has less than half the number of recommended palliative care physicians than the benchmark set by Palliative Care Australia. It's also true that Victoria had and still has the lowest number of palliative care physicians per person in the country. Before euthanasia was legalised, Victoria had 0.7 palliative care physicians per 100,000 people. Now it has 0.8 palliative care physicians per 100,000 people. So yes, it's an increase, but it's still only 40% of what's required to give people proper palliative care and proper access to palliative care at the end of their life. Across Australia, it's not much better. There is just one palliative carer for every 704 deaths that occur in this country. If Australia was serious about end-of-life choices, then it would put its money into palliative care, not into euthanasia. The Tasmanian government, Tasmania just legalised euthanasia, will spend $20 million a year putting their euthanasia system into place. $20 million to help people to die. How much are they willing to invest in helping people to live at the end of their lives? Until Australian governments put their money where their mouth is when it comes to palliative care, then we cannot accept the lie that euthanasia is about choice at the end of life, because it's not. One of the big problems with the significant healthcare costs of end-of-life care is that people feel like they're a burden on their family in particular. If the state accepts that some people should have the ability to take their own lives when they're at their weakest and they're at their most vulnerable, then a person can be forgiven for starting to ask, should they really expect others to care for them during this time of their lives? Or should they do the unselfish thing and end it all? Palliative Care Victoria, again, said that there's a real danger that legalising euthanasia and assisted suicide will lead to a growing sense of what they call a duty to die. I know many of us here are from migrant backgrounds. Think about the selflessness of our own parents and grandparents. So many of them came from nothing, gave everything for their families. Even those in our own families who are so committed to life still talk about how they don't want to be a burden on their loved ones. And I'm sure many of you know what I'm talking about. It's a real concern. In Oregon, again, more than half of those who said that they wanted to die said that they were concerned about being a burden on their family, friends, and caregivers, and that this formed part of their request. More than half said that they were concerned about being a burden on others. Less than a third said that they had any concerns about pain. The biggest motivating factors for euthanasia and assisted suicide aren't pain. It's existential problems. It's finance. It's burden on loved ones. What about those suffering from mental illness? Under the euthanasia and assisted suicide laws in Australia, having depression or some other type of mental illness doesn't disqualify a person from euthanasia or assisted suicide. The test isn't whether they're suffering depression or anxiety or some other psychological condition that might affect their decision. It's about whether or not they understand their decision. So if they understand it, even if they're depressed, even if they're anxious, even if they're suffering from a treatable psychological condition, it doesn't matter. That means we face a particular vulnerability for those suffering from treatable mental illness, because the laws don't require these conditions to be addressed before giving someone drugs to die. Mental illness is no barrier to obtaining a lethal prescription unless it's severe enough to make a person incapable of understanding the decision that they're about to make. And while we're on the topic of suicide and mental illness, what effect does the legalisation of euthanasia and assisted suicide have on suicide rates generally in a community? We hear from euthanasia advocates that it actually takes them down. They'll say, well, fewer people will commit suicide if you have legal assisted suicide. I know. It's not true. In Oregon, the reason I keep using Oregon statistics, by the way, is because assisted suicide's been legal there for almost 25 years, and they collect reasonably good data, probably the best data in the world on assisted suicide. So forgive me for keep on pointing to Oregon. But the suicide rate in the community is 43.1% higher than the national average. I'm not taking into account assisted suicide rates, they're counted separately. But amongst the general community, the people who aren't ill, suicide rates in Oregon are 43% higher than they are on average in the rest of the country. Do we think that's an accident? Or do you think it's because once the state starts saying to you that the best way or an acceptable way to deal with suffering is to take your own life, that message spreads out into the community? These laws have a terrible, terrible, devastating effect on suicide prevention initiatives. So that's the internal pressure, the pressure that we feel on ourselves. But what about the external pressures? We heard from Stephanie and Barbara about the pressures that insurance companies can put on you, but what about other pressures? Think about the number of inquiries we've had in Australia recently into things like elder abuse, aged care and disability care. The World Health Organization tells us that in countries like Australia, middle to high income countries, the rate of elder abuse goes somewhere between 2 to 14%, and it's usually quite underreported because the people who are usually committing the elder abuse are also the same family members on whom that person relies for survival and relies for their needs. How would a doctor agreeing to a euthanasia or an assisted suicide request be able to tell if the person's subject to elder abuse? How might they make sure that a person isn't feeling pressured to ask to end their life? What about aged care? We've just had the Aged Care Commission complete, and you would have seen in the federal budget on Tuesday night the government talking about a massive investment into aged care to try and overhaul the system. Someone will even say that if it gets fixed, it'll be the Prime Minister's legacy. But the stories that came out of the Aged Care Royal Commission were just horrible. The euthanasia advocates are actually boasting about it. So during the Royal Commission, I don't know how many of you have heard of Philip Nitschke. He's almost like the father of euthanasia in Australia. He's one of Australia's biggest euthanasia advocates. And he told media during the Aged Care Royal Commission that membership of his euthanasia organisation had skyrocketed during the Aged Care Royal Commission because people were now too scared to go into aged care homes. They say that's the time they would prefer to die, he said. Does that sound like choice to you? End of life choice? Having an aged care system that is so bad and that is so broken that people would rather take their own lives than go into an aged care facility? Is that the best we can do? Is that what you want for your grandparents, your parents, for yourself? Or do you want an aged care system like the one Sister Cecilia described to us last week, where people are welcomed as family and cared for as family right until the last moment? Where's the real choice, and who's pushing the real choice in this situation? And then we've got the Disability Royal Commission, and that's still going, but even in the time that it's been running, we've heard some extraordinary stories. I just want to tell you a few of them. Toni Mitchell had a son with a heart condition and also with Down syndrome. She told the Royal Commission that she had to fight every day for her son's right to live and his right to be treated as if his life was valuable. She said she had to fight every day for doctors to treat him as a person and not as a condition. Christine Reagan also testified, and she's a mother of a child with Down syndrome. Erin had a stroke when she was about 25 years old, and when Christine went to the hospital to seek help for her, she was told, oh look, she has Down syndrome. How hard are you going to try? Kim Creevy has a quadriplegic son. For him, the doctors asked, how much more money are we going to spend on keeping him alive? And do you have an end-of-life plan for him? When the UN representative for the rights of people with disabilities visited Canada, where euthanasia is legal, she said that people with disabilities, particularly those in institutions, were being pressured into euthanasia. And since the time of that report, things have gotten much worse for people with disabilities in Canada. Euthanasia has only been legal over there for 5 years. And while it began as just being available for people with a terminal illness, it's now formally and legally been extended to those with a disability. The condition doesn't have to be fatal or terminal. You can be expected to live for decades and still be eligible for euthanasia. And in 2023, the eligibility for euthanasia will also be extended to those with mental illness only. So within 8 years of legalised euthanasia in Canada, it will be open to anyone with a serious but not terminal illness, anyone with a disability, anyone with a mental illness. Euthanasia already kills more than 5,000 people in Canada every year. How many more will die once the eligibility is extended? It's not just Canada. The expansion of categories for whom euthanasia is available occurs wherever it's legalised. The only thing that's exceptional about Canada is how quickly it's happened. In the Netherlands, one of the first countries to legalise euthanasia, it's now available to children, newborn babies with serious conditions, people with dementia, people with mental illness, without physical illness. There are also movements for what they call completed life euthanasia, which would make euthanasia available to anyone over 70 years of age who feel like they've lived enough. In Belgium, in 2019, which is the most recent statistics we have out of there, 49 people were euthanised because they were suffering from mental or behavioural disorders only. It's about one a week. 448, more than one each day, was of a person not expected to die in the short term. 27 were not conscious at the time they were euthanised. In Colombia, euthanasia has been expanded to children over the age of 6, and parental consent is not required for euthanasia of kids over the age of 12. My friends, I could go on. It's the same sad and deadly story everywhere. Euthanasia activists jam their foot in the door and they keep pushing until the categories get expanded and expanded. The real euthanasia advocates, people like Dr. Philip Nitschke, will say that what he envisions is euthanasia or an assisted suicide being available to every rational adult who wants it. Where will we go in Australia? Where will we go? It's hard to say, but it's not looking good. Victorian Premier Daniel Andrews said that in the first year of euthanasia in that state, he expected that about a dozen or so people would die from euthanasia. About a dozen or so would take their own lives in their euthanasia program. He was wrong. Victoria had 124 deaths in its first year, with another 107 people approved for euthanasia but who hadn't used the lethal drugs yet. It took Oregon 17 years to reach the number of deaths that Victoria had in its very first year. I want to say that again. It took Oregon 17 years to get to the number of deaths that Victoria had in its very first year. Euthanasia and assisted suicide being introduced now is being introduced at the extreme end. Doesn't look good. It's not only when the laws change that the spread of euthanasia widens. Expansion also happens by default when so-called safeguards are not enforced. Doctors and other medical professionals don't abide by the rules, but they don't get punished for it. For example, despite one of the criteria for euthanasia in the Netherlands being the consent of the patient, the government's own statistics tell us that in 2015, 431 people were euthanized in that country without their explicit consent, more than one a day. Similar figures have arisen in Belgium, but no one has been prosecuted for these cases, not one. In fact, it took 16 years in the Netherlands for the first ever case of a doctor being prosecuted for somebody's death to hit the courts. And that was over the death of a 74-year-old woman who suffered from dementia. We don't know her name, but we know her story. Well, I know her story and I'd like to share it with you tonight. This woman had said that she had wanted euthanasia at some time, but when she herself decided that the time was right. And the doctor would ask her all the time, you know, do you want euthanasia now? And she'd say, no, not yet, it's not that bad yet. No, it's not that bad yet. Every time she asked her, and she kept pushing, the female doctor, kept pushing. But the doctor ran out of patience. And so the woman ran out of time. I'm going to read the news report of what happened the day that she died. On the day appointed for her death, the doctor gave the patient a sedative in a cup of coffee. She later explained the drug was hidden in the coffee because the patient would probably have refused had she have been asked to take the medication herself. Some 40 minutes later, the woman was injected with a further dose of sedative because the first was having insufficient effect. The report said the woman then appeared to become unaware of her surroundings, and the doctor prepared to inject her with a lethal dose of the drug thiopental. It said when the physician tried to administer the thiopental, the patient sat up. This is what the physician had just referred to as physical resistance. The family then held her down and the physician quickly administered the rest of the euthanate. No one disputed that this is what happened to this 74-year-old woman. But ultimately, the court acquitted the doctor, saying that she had acted with due care and was therefore not punishable. The doctor secretly sedated the patient and had the family hold her down while she fought back, and the doctor injected her with a lethal drug and she died. And the court called that due care. Do you want that for your grandmother? Do you want that for your mother? Is this what choice looks like? Is this where we want New South Wales to be in 20 years' time? Or can we do better than this? Of course we can do better. But my friends, we have to fight. We have to fight this as if our lives depended on it, because they do. Everyone's lives depend on it. So how do we fight? How do we join the fight against euthanasia? The first thing I want to say is that we have to pray. We have to pray and beg. The last time euthanasia was defeated anywhere in the country was on the Solemnity of the Assumption in 2018. And today's the Feast of Our Lady of Fatima. I don't think it's a coincidence. Prayer will get us there, particularly I think the fight in New South Wales. The next thing you have to do is ring your local MP. If you live in this electorate, your local MP is Tanya Mihalik. I think she's on our side, but it'd be worth giving her a call anyway. For those of you who live in other areas, find out who your local state MPs and MPs and ring their office and tell them that you are against any push for euthanasia, and do it more than once. The next thing that you need to do is to use your vote, right? The way that we defeat these laws now and into the future is making sure that we have good people in Parliament. The last time euthanasia was defeated, like I said, in federal Parliament, there was one vote in it. There was one vote in it. It was one by one vote, and it's actually an interesting story. It was a WA senator I think, named Peter Giorgio. And he was going to vote in favour of allowing the ACT in the Northern Territory to legalise euthanasia. His fiancée had tragically passed away about 20 years earlier, I think from cancer, and she had had one of those horrible deaths that the euthanasia lobby talk about. So he said, he couldn't bear to have somebody else go through that. What changed his mind is that he sat with a palliative care doctor who said, "I'm sorry, but she didn't have to die like that. If she'd had proper palliative care, she wouldn't have died like that." These stories, these heartbreaking stories of people suffering at the end of their life, aren't because they needed euthanasia. It's because they needed palliative care. People should never have to choose between suffering a painful death and euthanasia. They should have a third choice of having a good death, one where they're cared for in palliative care. Anyway, I digress. There was one vote in it, and he changed his mind. The last time euthanasia was defeated in New South Wales, there was one vote in it. It was defeated in the upper house and defeated only by one vote. Some of you might know, and I'm going to embarrass him, Lyle Shelton is here tonight. Lyle will be in the upper house in the New South Wales Parliament in November, and he and other members of the Christian Democratic Party will be asking for your vote in March 2023. Am I right, Lyle? March 2023? The best way that we can protect against these types of laws coming to our Parliament, maybe one of the best and most solid ways, is having more people like Lyle and his friends in the upper house. So, Lyle, shameless plug here, but my ballot paper will have a number 1 next to his name in March 2023, and I hope yours will too. We need good people in Parliament. If any of you feel called to parliamentary service, that's another way to make sure that we have good people in Parliament too. Though all of you would have seen, some of the horrible stories that are coming out of federal Parliament of, the scandals that are coming there. How do we stop these scandals? By good people standing up and seeking the vocation to public life, and it really is vocational. Pray, ring your local MP, use your vote. Things that you can do today. Sign up for updates to Hope. There are QR codes on your seats. Hope will be very instrumental in this campaign, and they will let you know when it's time for you to take action, and they will point you towards the action that you should take. So if you want updates, sign up to the updates, the QR codes on your seats. Sign up to the Australian Christian Lobby, another great group who does wonderful work in this area. For those of you who aren't already signed up to Archbishop Fisher's email updates, sign up to them on the Catholic Archdiocese of Sydney website. We will be feeding you information of how you can get more involved as this situation progresses. The other thing I would say is spread the word. Talk to your friends and family about the issue. Most of the people we know, most of our friends, most of our family aren't with us on this. Most of us stop at the situation of, well, it's all about my choice, and if people want to do that with their lives, that's their business, and we shouldn't interfere. What I hope I've impressed upon you tonight is that this isn't ever just a personal choice. Death is personal, but it's not private. Introducing these laws have effects on everyone and have disproportionate effects on the most vulnerable in our society. And they'll set the tone for the type of society we will be now and into the future, the type of society that we'll leave for our children and our grandchildren. And we can do better, and we have to do better than this. Thank you very much.